Hello everyone, my name is Kristen Zolkowski and I was the principal investigator for the simulation study at Lancaster General College. I'm sorry I could not be there to join you in person, but I'm glad I got to be able to do this presentation. This presentation focuses on the data collection and evaluation process, which was a huge part of my role. This first slide depicts what I did most in the sim study. So this is me talking to the students, and I always came in, mind filling out this evaluation form. When they saw me coming in the sim lab, they knew that they had some sort of paperwork they needed to do. After each of the community simulation scenarios, the simulation study students completed a 1-minute evaluation of their experience. The first question asked, how well did this community experience enhance your learning about community health? Students consistently rated perceived learning for all of the scenarios between 4.5 to 5 on a 5-point Likert scale. This question was the same for all of the scenarios, and they had a total of 12 different scenarios in the 5-week rotation experience. The community scenarios that were rated the highest in enhancing their knowledge of community nursing are the following. Nabila Mir was an unfolding case study. So they first met Nabila and they did a home visit, and they learned about her asthma and her COPD. In the second visit, they needed to follow up with additional teaching with her. Thomas Johnson was a male truck driver who came into a health fair, and the students needed to do a cardiovascular assessment and a history and then conduct teaching at the health fair. And Red Yoder, 1, 2, 3, he was an unfolding with 3 parts. He was also part of the NLN ACEs case. They needed to complete an intake assessment on their first visit. They found out he had diabetes and a foot wound, and when they went back the second time, all of a sudden they found a patient who had a worsening wound and deteriorating vital signs, and they needed to figure out what to do. So they needed to call the physician and call 911 to get him admitted to the hospital with sepsis. And finally, their third visit with Red was a follow-up visit after discharge from the hospital. Julia Morales was an unfolding case study, and the first time they met Julia, she was at home with cancer, and they needed to discuss some hospice concepts with her, and they needed to complete a focus assessment. The second time when they met Julia, she was actively dying, and they needed to provide some comfort care for her and also support her partner. In addition, we had a chaplain, a live chaplain, come in and help the students in that process and help that patient and partner with the coping process. The simulation team also developed a second question for the 1-minute evaluation to capture the qualitative data. The open-ended question was specific to each of the community scenarios. After careful review of the data, I noticed several themes emerged. This was the first semester that we used standardized patients in lieu of mannequins. When students were asked to identify what helped their learning in the scenario, they overwhelmingly stated that the SP made the scenario more realistic. Many of them also commented on recognizing the importance of family in the community setting. Additionally, they liked the audio clips that I talked about from the ACEs case. They thought that they got a better understanding of who that patient was before they walked in there. In addition, they experienced comfort care as a priority. They learned about holistic care and seeing the big picture. They appreciated the importance of empathy. They learned how to manage an emergency in the home. They realized that communication is key in these outpatient settings. They gained an understanding of the role of the community and hospice nurse. They recognized the value in determining root cause and non-adherence. They also were able to discuss pathophysiology concepts such as sepsis and diabetes. And finally, they were able to practice skills such as wound care and PICC care. And they were the main themes that came out of the data collection for the community scenarios. Thank you.